Hi, Alvin DeLeon here, and you are watching episode 45 of the 3-Minute Health Tip. And in this episode, I'm going to talk about jaw pain, also known as TMJ pain. Now, if you've ever experienced this jaw pain, it's a very uncomfortable thing to go through, partly because a lot of the times you're not quite sure if the pain is coming from the jaw or the TMJ, the temporomandibular joint, or is it coming from a tooth? And oftentimes people end up actually going to their dentist to complain about this toothache, or they think it's a toothache, and it's often the dentist that will diagnose them as having a TMJ syndrome. And a lot of times the dentist can't really do much with it. They'll tell you to maybe wear a mouth guard to prevent some of the grinding of the teeth, and oftentimes people end up going to manual therapists, chiropractors, physiotherapists, massage therapists that work on the muscles to try to mobilize the joints in the jaw. Sometimes if that works, and if it works for you, great. But for those of you that haven't got relief because that jaw pain either keeps coming back or it doesn't go away after the treatment, well, you're going to want to hear the G&M perspective of jaw pain. And if it wasn't for the science of the 5 biological laws in G&M, we wouldn't really know what to do, and a lot of people suffer through this jaw pain. So fortunately, what I've learned over the years of applying this model of looking at what's happening at the organ level, which is the muscles in the joint of the jaw, what's happening in the brain, and what conflict shock started this entire biological program, really helps to give people an idea of what's happening and to allow them to have relief from their jaw pain symptoms. And so the conflict that's tied to jaw pain is also known as a bite conflict. So a bite conflict, not being able to bite back, not allowed to bite back. Often it's related to being in a weaker position. So children will often get jaw pain because they're not allowed to bite back at their older brother or at their parents. A lot of us that have jaw pain, usually a woman may experience it because they're not allowed to bite back at their spouse or at their male boss. Also, there's bite conflicts that we experience because of not being allowed to bite back to somebody of authority, to your medical doctor or to a police officer or somebody of a higher position. So every time we experience an unexpected conflict, perhaps it's an argument, a criticism, an accusation, and we're not allowed to bite back, that tends to affect the part of the brain known as the cerebral medulla, and it could create changes to the muscles in the jaw, and that often lead to this jaw pain symptom. And one of the things that I know I've seen over the years, we've got great examples and case studies of this, where people come in with this jaw pain, and this one particular student, she experienced it after being accused of plagiarism from her professor. And so it was all a mistake. It ended up being thrown out, the case. She was able to prove that it was an honest error, and then that's when the jaw pain symptoms started to show up. There was also another case of a man that was crossing the border back home into Canada and was being accused or questioned a little more intensively by the customs officer, and he felt he wanted to say something derogatory towards that person, but he held back. He wasn't allowed to bite back at this customs officer, and shortly after arriving home started to have his jaw pain. And so those of you that are experiencing some jaw pain or TMJ syndrome, look for what was going on unexpectedly in your life prior to the jaw pain showing up, and who was it you weren't allowed to bite back at. Was it a family member, your spouse, a child, a co-worker? Make those connections, look at it differently, resolve the issue, and hopefully that will go a long way in starting to give you some relief from your jaw pain. I want to thank you as always for your attention, and I'll see you at the next episode.